I'm Dr. Waleed Moneir, Assistant Professor of Otorhinolaryngology Department. Today we are talking about facial nerve paralysis. These are 6 points to be fulfilled when we discuss the facial nerve paralysis. The first point is the anatomy. Facial nerve carries motor, parasympathetic secretory motor, taste sensation of the anterior two-thirds of the tongue, and somatic sensation of small areas of external meatus and external canals. This diagram shows the branches of the facial nerve, which are greater superficial petrosal nerve emerges of the geniculate ganglia, supplying the lacrimal gland and mucous gland of the nose and oral cavity. The second branch is nerve tostopedias from the mastoid segment, then cauda tympani nerve from the same segment, carrying the fibers of the taste of the anterior two-thirds of the tongue. Finally, the terminal branches of the muscles of the face and posterior digastric and stylohyoid. The facial nerve is surrounded by epineurium, perineurium, endoneurium, neurolemmal sheath, and myelin sheath from outside to inside. The motor nucleus of the facial nerve located in the bones. Its upper fibers is supplied by pyramidal fibers from both sides of the cortex, but the lower half is supplied by pyramidal fibers only from the cortex of the other side. Causes of the facial nerve paralysis. They are either upper motor neuron lesion, in which the lesion is above the motor nucleus, or lower motor neuron lesion, in which the lesion is at the motor nucleus or below. As regard to the pathogenesis of the facial nerve paralysis, according to Thunderland classification, there are 5 grades according to the severity of the affection of the nerve and its teeth. Of course, the severity of the symptoms is increasing in severity proportionately to the grade. The evaluation of the facial nerve paralysis is fulfilled by history taking, by asking about symptoms of the possible causes examination to detect the severity and the level of the injury. The comparison between upper motor neuron lesion and lower motor neuron lesions are depending on 2 facts: the difference between the pyramidal supply of upper and lower halves of the motor nucleus, and preservation of the extrapyramidal fibers in upper motor neuron lesions. To detect the site of the lesion, test the function of each part supplied by different branches of the facial nerve. The investigations of a case of facial nerve paralysis are topographic test to detect the site of the lesion and electrodiagnostic test to predict the prognosis. This diagram shows the topographic tests are requested to detect the site of the lesion. The electrical tests are electroneuropathy, electromyography, and nerve excitability test. The treatment of the facial nerve is conservative, causal, or surgical. The Bell's palsy is idiopathic with unknown cause, which is the most common cause and treated by steroid and antiviral drugs. The traumatic lesion of the facial nerve paralysis is due to either iatrogenic or temporal bone fracture and treated either by conservative or surgical lines of treatment. Thank you.